Hey, my name is Haley Thrift, and I'm an occupational therapy student at the University of St. Augustine. My research study was on chirotherapy and cold packs. This was a level 1 study, and the research question was, what are the effects of exercise, chirotherapy, and exercise with chirotherapy, and the effects on treating lateral epicondylitis? They also looked at the therapeutic efficiency of the newly designed control-release cold pack. There were 70 participants that met the criteria, 21 dropped out, and there were 49 participants left for the study. The participants were randomly assigned by choosing a number 1 through 4. The inclusion criteria included patients had to be 18 years or older, they had to have pain to the lateral elbow, they had to have symptoms present more than 3 months, they could not receive any treatment or surgery in the past 3 months, no history of other musculoskeletal or neuromuscular disorders of the involved upper limb. The exclusion criteria included musculoskeletal or neuromuscular disorders of the involved upper limb, they were younger than 18 years old, they received therapy or surgery in the past 3 months, and they had pain in other areas other than the lateral elbow. There were 4 groups, intervention groups. The first group was an exercise-only group. This group was given a traditional exercise program to treat lateral epicondylitis, and they included a resisted forearm supination when sitting with the elbow flexed to 90 degrees. They did this for 3 sets of 10. They also used a resistance band and resisted wrist extension with the elbow flexed to 90. They also did this for 3 sets of 10. And they did a straight arm wrist extensor stretch with no resistance and held this for 20 seconds. The second group was a gel cold pack and exercise group. They did the same 3 exercises as above, and they also applied a standard cold pack to the affected lateral epicondyle for 20 minutes on, 10 minutes off, and then 20 minutes on again using a second gel pack. The third intervention group was a Chiro Max and exercise group. They also did the same exercises, and the cold pack instructions were the same, but the Chiro Max pack was used instead of the regular standard gel pack used in the second intervention group. And a second Chiro Max was not necessary because it maintained its temperature. The fourth intervention group was a Chiro Max only group, and they applied the Chiro Max to the affected lateral epicondyle for 3 cycles of 20 minutes on and 20 minutes off. These 4 interventions were all performed twice a day, at least 4 times a week, for 6 weeks. The measure and outcomes of interest, the subjective measures were the DASH, which is the Disabilities of the Arm, Shoulder, Hand questionnaire, and the pain scale, which they tested pain with picking up a chair test. The objective measures was grip strength. The statistical test included the ANOVA and the SPSS statistical software. I deemed that these tests were appropriate for these studies because the ANOVA is a test used when there are more than 2 groups, and this study had 4 groups. And the SPSS is used for managing and calculating a variety of data, and this study measured 3 measures plus for all 4 groups for pre-treatment and post-treatment, so there were a lot of data collected. The findings that the authors decided that were statistically significant were all 4 treatment groups showed statistical improvements in DASH scores, pain levels, and grip strength. There was no difference found among the treatment groups, indicating that no one method of treatment was superior or inferior of one another. The clinical significance was found that all groups that received the treatment showed functional improvements measured by the DASH, and this also increases quality of life. Anything that can make the treatment easier will increase compliance for the participants, and results showed that the preference of the Chiromax over the standard gel cold pack was deemed successful. Patients should always be instructed by the therapist to monitor symptoms during and after treatment due to the cold treatment adverse effects that could show. The conclusions were the participants with lateral epicondylitis reported a decrease in upper extremity disability after the 6 weeks treatment, but it was not statistically different between the 4 treatment protocols. They also concluded that exercise and/or applying the gel pack or the Chiromax is an effective treatment for lateral epicondylitis, and participants preferred the Chiromax over the standard gel pack due to the ease of use, comfort, and effectiveness of the Chiromax. The strengths that the authors decided were that there were a sufficient number of participants that participated in the study, and all of these were randomly assigned groups, so this made it a level 1 study. The limitations: there was no true control group, the subject compliance was an issue, and imputation of missing data is disputable and to some taken to be conservative. So how are we going to apply this to practice? The results of the study are congruent because modalities is widely used across the OT settings and diagnoses. Chirotherapy and the use of cold packs are acceptable for decreasing pain, spasticity, spasms, reducing edema, and metabolic activity. This modality is commonly used for acute injuries regarding the musculoskeletal and neuromuscular systems. Cold packs can be used in the clinic as well as by the patient at home. This research study deemed using cold packs positively affected outcomes with the addition of functional activities. And this study also provided value on the use of the Chiromax gel pack being preferred by patients when compared to a standard gel cold pack. So how are we going to use these results? The information provided definitely needs to be taken into consideration when practicing. Having evidence to support the use of cold packs for the patients that qualify is very important. Knowing that the majority of participants in this case preferred the Chiromax will also be valuable because this gives options to the patients. This study deemed that chirotherapy was effective in treating lateral epicondylitis, as well as using therapeutic exercise, and knowing this, using chirotherapy in combination with functional activities and therapeutic activities will be my first choice when seeing acute case of lateral epicondylitis. This is my references, and thank you for your time.